Case number 12. A 22-year-old male with sickle cell disease presents to the emergency department with a painful and prolonged erection lasting over 4 hours. What is the medical term for this condition? A. Erectile dysfunction. B. Orchitis. C. Priapism. D. Peyronie's disease. Correct answer. C. Priapism is a serious and often painful medical condition in sickle cell disease characterized by prolonged and unwanted erection of the penis. It results from vasoocclusion of penile vessels by sickle cells, leading to impaired blood flow and prolonged erection. Priapism is a urological emergency that can lead to tissue damage and permanent erectile dysfunction if not treated promptly. Management may involve hydration, analgesia, and in severe cases, surgical intervention. Peyronie's disease is a condition in which fibrous scar tissue forms in the deeper tissues under the skin of the penis. Orchitis is an inflammation of one or both testicles. Erectile dysfunction, also known as impotence, is defined by difficulty getting and keeping an erection.